Hi, we're the ASIJ iGEM team. iGEM stands for International Genetically Engineered Machine and is an annual competition where students utilize synthetic biology to tackle and solve world issues. This year, we have decided to focus on breast cancer. Breast cancer affects millions of people around the world every year. If it is detected early and is localized, breast cancer patients have a survival rate of 99%. However, not enough people are getting tested, especially here in Japan. The screening rate for women over the age of 40 is only about 40%.
These statistics inspired our team to search for an affordable, convenient, and comfortable way to detect breast cancer. Our project, Abracadabra, makes use of molecules called aptamers that can selectively bind to our target marker. Through a strand displacement assay, the aptamer will bind to the biomarker and the complex can be detected through PCR or quantum dot assay, creating an effective method for precise detection. Apart from our project, we believe that it is essential to raise awareness about breast cancer and our understanding of it. Through collaboration with Korea HS, another iGEM team working on the creation of a novel fusion CPP that penetrates cancer cells with siRNA, we have created this video that surveys various members of different age groups from both the Japanese and Korean community about their understanding of breast cancer. We hope that people of all ages and backgrounds can leave this video knowing more about breast cancer.
Cancer, from my knowledge, is when your DNA is sort of a mutation in your cell. Once one mutation happens, then they will just duplicate, and just after a long period of time, the cells will all mutate, and eventually, for example, if it's a vital organ like your lungs, then you'll just break down.
Breast cancer is a tumor full of cancer cells in the breast area.
Cancer is actually some cells going rogue. That means that they generally go and grow in a fast and uncontrolled way. And in this way, they take a vital, let's say, substances from other cells in order for them to proliferate. Proton genes are genes that generally regulate how fast the cell will proliferate. So when a genetic mutation happens there, and this is no longer controlled, these cells have the ability to expand and proliferate even more without having a mechanism to stop them.
Each type of cancer is quite different. So if you have a tumor in the brain and a tumor in the skin, they're two very different diseases. The main goal is to remove as many tumor cells as possible, and while keeping the damage to the normal tissue as little as possible. One for some certain cancers is surgery.
Surgery is a bit tricky as well because cancer has the tendency to spread as much as it can. So you have to find it before it spreads to another organ or to another tissue. And you need to cut as much as you can in order to contain the cancer cell, but at the same time, no cancer cells must be left on the location because afterwards it'll just start to create a new tumor.
One way it could be treated, I know of, is chemotherapy, and I know it's not very efficient, but because you can have like side effects like vomiting or nausea and stuff like that.
My teacher also had cancer, but it was like early on stage. So what they did was they just laid on. She was like sitting down on like the table thing, and then they just sent down a laser down, and then it doesn't like make a huge scar or it doesn't make a scar at all, and then it just burns the cell off, and then that was really cool.
Radiation is usually you do it in some doses, and you bombard the cancer from different angles in order to destroy as less cells as it is possible from all the different organs.
And there are other types of treatments like molecularly targeted treatments which use characteristics specific to each type of cancer to kill the cells. There are also immune therapies which have been developed lately, which actually try to improve the reaction that our body has to stop the cells from growing or to kill the cells. So actually that depends on the type of cancer. However, I think that even for the cancers which have very efficient treatments, there is still room for improvement.
No, in no way. That's why many people actually have, after some years, a cancer that recurs. Because it is, well, you have 1 trillion cells, and if 10 million of them are cancers, you're gonna misplace one of them. So it's pretty tricky to catch them all. So that's why you need treatments that are as specific as possible. And that would be a huge step to, let's say, solving the problem with cancer.
So that depends on the type of cancer. It probably also depends on the age and some other factors as well.
Basically, there's something else wrong in your body. For example, like you one day wake up having like you cough up blood or something, and then you go to the hospital because of that, and then you do treatment, and the doctors are like, maybe you have cancer. So you check it, and then that's how you know you have cancer.
First sign that will lead to that diagnosis is to touch the breasts and find for specific hard spots that it isn't cancer, it isn't a diagnosis, but it's the first lead that will tell you to go to the doctor. It could be a calcium deposit or something else, but it's very possible that it could be a tumor. I guess one of the most prominent methods is a biopsy, where you take a piece of the tissue and then you put it under the microscope. Possibly you use some specific coloring, let's say, to identify the cells better. And after seeing their shape and how the tissue has changed, because there is a specific way that you would see the tissue under the microscope, you can understand if you're seeing a cancerous location.
I know that you can use a mammogram, but I heard they're very uncomfortable to use. So yeah, that's one of the ways.
Well, as it was for treatment, I think there is always room for improvement. And some tests are less invasive, some screening methods are less invasive than others. Patients would want tests that are as little invasive as possible and that give the highest results. In general, like in many other countries, I think people know still very little about the disease itself, and not knowing much about the disease can translate into fear.
I'm sure it's hard, especially if you have to do chemotherapy. It's probably hard. And
I think it is very difficult to imagine the complexity if you are not actually a patient, but it also affects the life and the family, and there are many things that we as a society and as researchers have to think about when we think about cancer. So in addition to treatment and screening, which you just asked about, I think that cancer prevention is also important.
It sure is a problem that hasn't been solved, and it needs a different angle. And I think that's where personalized medicine comes and tries to divide the different cancers into subtypes and try to deal with each one on their own. So I have my hopes up that in some years from now, we'll be able to treat most patients, and cancer could be a problem of the past.